So my name is Lianne, or Dr. Lianne now, which is quite exciting. I have a Bachelor of Veterinary Science with honours. Oops, go to the next one. Oh, that's not going to work, is it? Hang on, apologies. Oh, why is this not working now? I literally can't see my mouse or anything, so this is really handy. Can you unshare screen me? I don't know why this isn't working.
Yeah, let me see if I can do that. I'm not, do you see like a stop button anywhere, like a stop share button at the top of your screen by any chance?
I do, but I don't have control of my mouse now.
Oh, okay. Sorry, let me see if I can do that. I'm so sorry.
Apologies, everyone. I'm shocking at this.
Oh, perfect. I think I stopped it.
Okay, yeah, cool. Can do it now. Okay, cool. So as I said, I am Dr. Lianne Mellin. I have a Bachelor of Veterinary Science Honours, and you can find me on all my social media under Your Vet Lianne. So I kind of do lots of Instagram and a bit of YouTube. Also have some things that I share on Facebook and that kind of thing. But basically, I am a veterinarian. So I studied at the University of Queensland, which is in Australia. I don't know if you can tell that I do have a bit of an accent. It's a bit all muddled up because, yeah, oh, is this working? Yeah, sorry. I suddenly thought I'd lost you guys. So my accent is all muddled up because I am actually from New Zealand, but I went over to Australia and got this weird accent in 3 weeks. I currently work in Auckland, New Zealand. I'm on a little island. Well, I commute to a little island just off mainland Auckland, and I work as a GP veterinarian there. So why did I choose veterinary? Basically, I wasn't one of those kids who decided on becoming a veterinarian until I was from a young age. I only decided halfway through my final year of high school. So during high school, I kind of had the idea that either I'd be a primary school teacher, a journalist, or a vet. The vet was kind of like iffy because I was like, I know I like science and I know I love animals, but I'm very not great with, well, I wasn't very good with blood and guts, because when I thought of blood and guts, I thought of people and imagined the wounds that people had. I imagined it on myself, and then I got really creeped out by it. So I knew I couldn't be a human doctor. So vet was the next option, but I still didn't know, well, I suppose not the next option, but an option. I still didn't know if I could deal with all the gore and everything. So I kept my options open at school. I'll talk about what subjects I did. But as I say, I only decided halfway through my last year of high school to be a vet. So I tried the whole primary school teacher thing. I was part of running an event with what we call intermediate school age. I don't know what that is in different countries, but it's like 12 to 14-year-olds. I ran an event for them, and I realized, like, you know, I like kids, but I realized I didn't like them enough to hang out with them daily, especially if I want to have kids in the future. I was like, hang out with kids, teaching them, and then coming home to more kids is just a little bit too much for me. I really like journalism because I love English. That was my favorite subject at school. But I kind of thought, in this day and age with all the sort of online things that people, I mean, with Instagram, you basically your own journalist sort of thing. I was like, I don't know if I can make a career out of that. It's not super big in New Zealand. So I decided I probably wasn't going to follow that through, and that any writing that I do would be more of a hobby for me. And then it came to vet, and I still wasn't sure because obviously I still love my animals. I've been riding horses. I'd say I'm a horse girl, but like not the classic horse girl that everybody's like, oh, stay away from, because I never owned my own horse. That's what I tell myself anyway. So my mom organized for me to go to my local vet practice one day during school hours to just see whether I would be able to deal with surgeries and all that kind of thing. And I remember watching a spay, so the removal of the uterus of a female dog, and just being like, wow, that's so interesting. Like my whole brain just switched to the science mode and everything. And I was like, oh my gosh, this is so what I want to do. And then just working with the clients and stuff, I was like, yeah, I'm sold. This is my new job. So I walked out of that day and being like, okay, everything I do from now on is going to be for me to get into vet school. And my massive why behind it all, because I think it's really important to, yes, you want to do this with your life, but why do you want to do it? What are you achieving? Otherwise, I feel like you don't, feel successful in your life. My massive why is I want to make a difference in someone's life. And that's kind of why I was thinking down primary school teaching, because I'm sure we all remember a primary school teacher that were just like, yeah, they molded me into the person I am today. So I realized that through vet, I can make a difference in an animal's life. And by making a difference in their life, I'm actually affecting their family as well, because people are so connected to their animals. So if you can help that animal, even if it has to be putting them out of pain, you've actually helped the family at the same time. And that's just my biggest way of defining whether I'm successful or not. So how did I go from high school to vet school? In New Zealand and Australia, when I was applying, it was very based on your academic grades, not really anything else that you had done. So at school, I did chemistry, bio, maths, and English in my final year of high school. I had also done physics beforehand. So it was very heavily science-based, and then obviously threw in English because I loved it. And I got into what's called pre-vet at Massey University, which is the only vet school in New Zealand. I got into that just with my year 12, so I did 13 years of high school, my year 12 entrance. And you have to do 6 months, so the first semester as a pre-vet student. And for that, you do physics, bio of cells, bio of animals, and chemistry. And then they take the top grades from that, as well as if you do what's called a Stat F test, which is kind of a little bit to see that you've got common sense, I guess. And I did well, but I didn't do well enough. I think there was like 430 odd people applying. There were only 100 positions, and I was 30 people off getting offered a position, which was really difficult to deal with. I felt embarrassed that I hadn't done well enough. And I told so many people, this is my plan in life. And I just kind of had to deal with that myself. But at the same time, even though I was rejected, I realized that this is definitely something that I want to do. I put my heart and soul into trying to get in. So I just needed to keep going. So then I spent the second semester doing plants, bio of animals, and psychology. And I'm pretty sure there was another subject, but I honestly cannot think what it was at this stage. And I did those subjects in order to get my grades up, which I managed to do. I ended up like straight A's, like different types of A's kind of thing, at the end of that year. So in the meantime, it was introductory biostatistics was my other subject. In the meantime, I had looked into applying to Australia, because, as I said, there was only one vet school in New Zealand. So I looked into applying in Australia, and the University of Queensland was the one place that I found, because it was closest to New Zealand, sort of like just geographically wise. And yeah, I was like, it's a 5-year degree. It's still a Bachelor of Veterinary Science, because some places do a DVM, but the other problem with that is you have to do like a certain number of years and then reapply to get into the DVM, and it was just a lot more that I wasn't sure I could do, like whether it was worth going to Australia and then still having to reapply and not necessarily being in in vet school, I guess. So I applied and my grades were good enough, and there's a huge long story behind it, which if you're interested, I do have a YouTube video all about it. And I ended up getting into Australia. Again, this is all based entirely on grades. They have changed the system a little bit more now, but that's what it was for me when I was getting into vet school. So what do vets do? I mean, you've got the classic general practitioner, which is a GP, which is what I am now. We see everything. So we have consults in the throughout the day, and what we do is we do a physical exam on the animal, we ask history questions, and we try and figure out what is wrong with the animal. It's like when you go to the doctors, that's what the same sort of thing. But then on top of that, we also do the surgeries. So the classic ones you'll know of are your neuters, or your desexing. So spay for a female animal, which is an ovariohysterectomy, removing the entire uterus. Or we do castrations, so removing the testicles, and we do this on all animals. So that's one big thing. We have to know all the different species. We also do other things like there's orthopedic surgeries. So a very classic surgery is a cranial cruciate ligament, which is equivalent to the ACL. I think you've probably heard of a lot of sports people rupturing or tearing their ACL. So there's different types of surgeries we can do for that. With those ones, though, we obviously have to let the clients know that we aren't specialists. We are capable of doing the surgeries if we have the right equipment, but yeah, there are specialists that do this day in and day out. They're obviously more expensive, but clients can go to them as well. We also do eye surgeries. Just the other day, we removed an entire eyeball out of a cat, and then he had an ulcer on his other eye, so we had to close that eye up so that it has time to heal. So he's basically blind for 2 weeks, but then we remove that, we open that eye up again, and he should be able to see and everything should be fine. What else? We do dentals, which I'll talk about soon as well. And we have to do anesthesia, so keeping the animal asleep while all this is happening. We do radiographs, analyze them. We also do cytology, so looking at cells underneath the microscope, so ear cytology, skin cytology. Skin cytology includes looking for parasites like your fleas or lice, but it also looks at different lumps to see whether they're cancerous or not. So there's a lot that goes on. And then if you're a GP with large animals as well, depending whether you're doing production animals or lifestyle animals, which are like hobby farmers, you can also do pregnancy testing. So that's the classic, I don't know if you've seen, but inside the cow's bum to try and figure out what stage they're at with their pregnancy and all that sort of thing. So there's a lot that goes into being a GP vet. There's also other areas, so emergency vets. Obviously, if you're a GP, you do see emergencies too, but you can be a dedicated emergency vet. If you follow somebody like Dr. Gerardo Polly or Dr. Brooke or Dr. Alex Hines, they're all emergency vets, and they often work night shifts. They do the crazy hours, like the public holidays and all that kind of thing, and they see the whack surgeries. Like they'll do a GDV, so that's like when the stomach has twisted and expanded and everything, and they'll try and save those animals' lives, or your snake bites, your tick paralysis, which is a big thing in Australia. We don't have either snakes or ticks in New Zealand, well, paralysis ticks in New Zealand, so it's a little bit less scary, I guess. But you're seizuring dogs, you're hit by cars, all that sort of thing, they do that, and they're very specialist with that. They'll see a CPR quite often, whereas for me, I won't really see that as often as a GP vet. So they're the like adrenaline junkies, I would say. And then, as I mentioned, you can also be a specialist. So a specialist, I'll talk about a bit more in terms of how to get into that, but they have to, there's a lot more studying behind it, and they can go into literally being an animal dentist, literally just seeing eyes, literally just doing bones and that kind of thing, or a specific species. So you could be an equine vet, where all you see is horses. So that sort of thing. And then there's also other roles within the government. So there's making vaccines. There's roles within abattoirs, because animals still need to be looked after even to the very end. And I know that's a very controversial thing, but we as vets are dedicated to making sure that animals have the best lives possible. And if that's an industry that's going to continue anyway, the whole abattoir side of thing, we need vets there to make sure that it's as humane as possible. There's other things like within the government. So if we have zoonotic diseases, I feel like this COVID thing is a huge thing that everybody's kind of aware of. But, you know, it's like figuring out how something from one animal has now spread and become within the human side of things. So it's a whole One Health organization and everything. So there are so many different pathways that you can take just by becoming a vet, just with your DVM or your BVSC. Yeah. So that's me doing, I was quite excited, my first stitch up of a dog. It came in with a wound on its chest. It had been playing in the park, all happy as Larry, with 8 other dogs. It was like a wooded area, and then came back to the owners and it was just like bleeding. So they were like, oh my gosh. And they brought it into me. Thankfully, it was deep, but it hadn't got any important structures or anything. So it wasn't gushing blood or anything. So I just kind of cut it open a little bit more. You have to make sure that the tissue that you are working with is vital, so alive, and is going to heal fine. And then I stitched it up. So that was quite exciting for me. So as I said, you can go into working straight away, so as a GP vet, which is what I've done, or you can follow the path of an internship, which is what a lot of people do as well. I think a big difference with that is you'll probably start with more money as a GP, getting paid more money as a GP vet than in an internship, because you're actually working as opposed to still kind of teaching, being taught. I think as a GP vet, straight away you get a bit more responsibility from the get-go, because as an intern, you have your own cases, but I think you still kind of discuss them with the other vets in the area and that kind of thing, because you're generally working in a more like in a specialist kind of area. So obviously if people bring their pets, they want to see the specialist. Lots of people go into internships if they have plans to become a specialist in a certain field later on in life, because generally you do 1 or 2 internships and then you do a residency and then you do all these exams within it, and then you become a specialized vet. I decided I didn't want to go down that path because I got a little bit over studying by the end of it. I'd rather just get stuck into it and have clients and, you know, just kind of learn as I go. But for a lot of people, going into an internship is great because you do get a lot of support. I guess if you go into a GP and you haven't got the mentorship, like I'm really lucky, I've got great mentorship. If you haven't got that, being an intern is great because you do have that sort of mentorship. Yeah. So I thought I'd tell you guys a little bit about a few of my cases. I will just point out that any of the pictures I've used, I do have.
Dr. Lianne, I'm so sorry to interrupt you.
Hmm?
I think I misunderstood. I don't think your screen has been sharing. I don't know if you've been using a presentation.
That's so funny.
But I figured now that you're doing like cases, like this would be a good time to like.
Oh, love that.
I'm
Okay,
so
well,
sorry. I
no,
didn't
that's fine.
understand earlier. Yeah.
No, you're good. Just got my face. Can you see things now?
Yes, yes, that's perfect.
Okay, I'm just gonna
Still
leave
have
it like this just because
control. Perfect.
yeah. So here's my little words. I'll just whiz through. There's not very many photos, but there's the photo of me doing the suture. And then we'll keep popping through. Oh, I don't need my face up. Okay, so now we've got my alpaca case. You can still see this, it's all fine.
Yes, yes.
Brilliant. Cool. So any pictures that I show, as I say, I do have permission for social media. So this was my first case as a farm vet, because what I'm working as a mixed practice vet. So within GP, I should probably explain, you can be a small animal GP, you can be a large animal GP, or you can be mixed. So mixed means you see smallies and largies, which is what I really wanted to do, because I love just seeing all the species and being tested by, you know, or having to know all this stuff. So I specifically as well decided that I wanted to work at a place with mostly lifestyle animals, which I think some people know as hobby farming, because I didn't really want to get into all the production side of things, because so the production side of things is more like working at dairies or beef farms. So a lot of prig testing and a lot of seeing animals quickly, as opposed to in the same way that you'd treat a dog or cat. So that's why I went down that side of things. So I had this beautiful alpaca as my first farm visit. And my heart was racing as I'm driving to this farm visit. And I'm like, oh my gosh, I'm actually the vet. Like, I have to tell myself, like, come on, Lianne, you're the vet. You did 5 years of study for this. You know what you're doing. You know, this solid pep talk for myself. And this poor alpaca had been attacked by a dog. I haven't put the pictures up there because they're quite gory, and I'm not sure what kind of stage everybody's at with dealing with gore. But this poor thing, in her hind leg, she had literally just been, it had been ripped. Like, there were so many puncture wounds, and it was pretty nasty. So what I did was I gave her some pain relief and some antibiotics, and I also gave her an injection for tetanus, because we don't want this getting any nastier than it is. And I cleaned it up, and then I placed a bandage, because this attack had actually been worse than we had been expecting. A lot of the time we get a call and it's, my alpaca's been attacked by a dog, but it's kind of just like a little scratch where you can just bandage and keep clean and all that. But this was a proper attack. So I placed a bandage, and I knew that it was likely to slip down just because of the position where the bandage is. It's, if you've got a bandage needing to be up there, it's not likely to stay, but if it's down the bottom, then it's fine. So I knew that I'd have to go back to the clinic and get my boss, because she's a great mentor, and just see how she would deal with this case. So we went and got a last stitch up kit and everything, and re-cleaned it. But in the meantime, even though I had cleaned all of that wound, just from being outside in the area prior to me getting there and everything, and then afterwards, flies had somehow managed to get in because the bandage slipped and literally laid their eggs in the wound, and then maggots were crawling out of it by the time we got back, which was only like an hour or two, which was absolutely disgusting. So then we had to re-clean it, and my boss stitched it up and showed me how she worked it and everything. And it looked like it was going to heal fine, like it was all good. The problem is the flies, because if more flies got into it, they would basically eat her alive, which from the inside out, which was pretty rank. So then we had to be a bit creative. We re-bandaged the area, but this time we used super glue and kind of around the leg, and then glued on the bandage so that it won't fall off. It's all good, like it's not toxic or anything, and you can kind of just shave it off, which is fine. So it wouldn't hurt her in any way, and it was more important to cover it up than to leave the wound there for flies to lay in it. But then we had this problem. So she was on this hill You can see this absolutely stunning view. I can't believe I get to work here. But down here is a hill, and she was all the way down there. And then we had to somehow get her back up the hill because we wanted to put her in a float, a horse float, because then we could keep her indoors and we would have fly spray around, and the owner would be able to check on her regularly because she still had to give her some antibiotics daily, sort of thing. So then we had this big problem of how the heck do we move a 60 kg alpaca that's really quite sore all the way up the hill. So the owners had this ride-on lawnmower, which they rode all the way down to her, and then we had this random trailer. So we managed to pick her up and put her into the trailer, which was cool. And then the ride-on lawnmower basically took her up the hill. But then we had the problem of the ride-on lawnmower not being strong enough to kind of like keep going up the hill because it was really steep. So I laughed at my life because I was like, how have I ended up like this? Because the owner was on the lawnmower, the other owner was pushing the lawnmower, and I'm at the back holding this alpaca in the trailer, pushing the trailer up the hill. It was quite funny. I had gone to the gym in the morning, which I don't usually do. So I was just like, I'm exhausted already, super hot, pushing up this hill. I just laughed at myself. I was like, what a life I lead. But it was quite funny, and we got her up and we got her in the horse trailer in the end, and I'm happy to report that she's healing well. The flies didn't end up getting in there and everything. We're still checking on her because it's a long enough process, but yeah, we're really happy with it all. So then, as I said, I work as a GP, so for a mixed practice GP, so I see both largies and smallies. And just yesterday, I had a crazy cat vaccination that I had to do. So the reason I put this slide in is because as much as we try to accommodate the animals and make them feel comfortable being in the clinic, we understand that not all animals are going to like to be there. So we try things like giving them treats, especially so when we take their temperature, we have to put the thermometer in their bum, and obviously that's quite uncomfortable. It's not too bad, but they're just like, oh, what's happening? So I always try to get the owner to hold treats in front of their face, just as I go to put the thermometer in, so that they're distracted. And we also use lots of techniques like fear-free handling. So there's a whole course that you can do on that. So like with cats, often less is more. You don't try and I guess hold them really tight, because then they get more flustered. But what you can do is what's called a kitty burrito. So you pop them on a towel and then wrap them up in the towel, so their legs are all in the towel and can't scratch you, and you kind of just hold them at the back of their neck, not scruffed, but just like holding the towel, and they do really well with that, and that sort of thing. But this cat, it was a new patient to our clinic, and so this is the first time I'm seeing it and everything, and we get it out and it seems pretty happy on the table, and I'm examining it. And I look at the teeth, because that's something I always do when I do a physical exam. It's like very thorough. And I look at the teeth, and the owner's like, oh, you're really brave. And I was like, oh, okay. Anyway, carry on. And then I move on, and I feeling the tummy, because you have to make sure that there's no lumps or bumps in the tummy, and that they're soft and comfortable. Because if they're really scared, they can be quite tense. So you actually can't feel everything in the tummy. But they can also be like that if they're painful. So that's what you're kind of looking for. And I'm feeling away and everything. And then I finish feeling the tummy. She's like, oh, he doesn't like his tummy being touched. And I was like, oh, okay. He was soft and comfortable, but he was a bit vocal. So I was like, that's all right. Anyway, finish that bit. And then I literally just stroked him over his hip. And this whole cat's attitude immediately changed. He turned around, hissed at me, and then jumped off the table. And I was like, okay, he might be painful on his hip. So I asked the owner. Apparently he's got no problems with his hip, hasn't been limping or anything, so it hasn't been lame. So I'm not sure why. He may have just been over it. He may have been like, okay, you felt me up enough, I'm sick of you, I'm getting out of here. But the reason this cat was in was because it needed a vaccination because it's going to be boarding at the cattery, and it's really important that they are vaccinated so no infections are spread while everybody's in together. So I still had to do my vaccination of this cat, but then it's walking around in the consult because it had hissed at me and jumped off the table and was like, nope, I'm not dealing with you. And so I try to like go and pick it up, but it's now gone behind the chair. So I was like, okay, I'll just like let you chill out a little bit and ask your mom some more questions and everything, just make sure we're all on the same page. And then he decides, I'm not going to hang out with you. So behind my table, we have like a little, I guess, cubby hole with our fridge sitting there, and then there's a bin inside, and he got inside that area, and I was like, cool. Now I'm going to have to try and get this cat out, and he's not chuffed. So I try to like lead him out with coerce him out with treats and everything, and he was like, no, I'm not coming out. So I was like, oh, maybe his mom can help him, and he's like, no, I'm not coming out. So I was like, oh, this poor cat, like he's stressed, but I'm gonna have to get him out. So I decided that I would grab a towel, because often if you cover their eyes, they're suddenly like, okay, I'll do whatever you want, like I'm not so stressed anymore. So I try to do that, and it was working all fine, and I was trying to grab him just kind of behind the neck so that it was away from all the bitey scratchy bits. And he's fine. And then suddenly he's like, nope, not fine anymore. And this thing just launched at me and tried to bite my face and scratch my face. Luckily, I like managed to pull back in enough time, and he missed my face, but he did get my hand. And it's the smallest little scratch, but far out, it's really sore. So then I said to the owner, I was like, okay, because we ended up managing to get him back into his own little cage and, did everything as stress-free as possible. So, okay, I'm just going to pop out the back and get my nurse to help me so that we can, do this as stress-free as possible, because I was going to put him in his little kitty burrito. And then I get out the back, and he's just like slashing at us. And I was like, okay, we need to give this guy a little bit of time. Anyway, we managed to vaccinate him. And try to make it as stress-free as possible. But what I've kind of learned from that case is sometimes they need drugs prior to coming into the clinic just to make them a little bit more calm. So that might be something that we need to deal with next time he comes in. Or instead of doing the whole physical exam first, like just doing the most important things, so listening to his heart, listening to his lungs, probably not needing to take a temperature if he's going to stress out with that, do the vital things first, and then vaccinating before continuing with the other things, just so we don't stress them out so much. So it's really a case-by-case thing. Sometimes the animals wag their tail, or if they're a dog, or they rub up against you and that kind of thing. So some of them really like coming to the vets, but some of them don't. So it is just a case-by-case thing, and you just got to do your best to try and make sure that they're enjoying themselves as much as possible, I guess. Yeah. So as I said, we do other things, like I've done lots of ear consultations. In this photo here, I'm looking down the ear with an otoscope. I'm looking for any redness, any discharge, and then we can do ear cytology. So that's where you take a swab of the ear, put it on a microscope slide, and then you stain the slide up. And then you can look under it for different bacteria, different yeast, even for parasites sometimes, like mites and all that. And then you can figure out from there the next plan of how you're going to treat the ear problem. What I'm doing in the second picture is actually doing an ear clean. So you kind of take out all the big gunky bits with a swab, and then flush it with some medicated kind of stuff, and then literally just massage it and swab it and clean it. This dog, his ears were really painful because he was quite, they were quite a big infection. I think he'd been swimming or something, and his ears hadn't drained or something along those lines. So we did have to sedate him in order to look at his ears. So that's why he's just kind of lying there. Otherwise, he would have been quite upset with it. So that's another way that we kind of manage their feelings and try to make the process as stress-free as possible, because he's basically not aware of what we're doing during that time, and basically wakes up with nice clean ears that aren't so sore anymore. But I do have a bit of a funny story with this one. So it wasn't this dog in particular, but I had another case, and this is again with the mentorship. So my boss is really good in the sense that I can come and ask her anything, or she'll pop into my consult and just make sure I'm doing everything appropriately, or if I have any questions I can ask them then. Anyway, I have this big dog. So it's a Hunterway cross. I'm not sure if you guys know what a Hunterway is, but it's like a New Zealand sheepdog sort of breed. So it's pretty big. I think it was crossed with a Labrador or something. And she was quite a timid girl. So obviously lots of treats, lots of pats, like made her feel really happy. But I needed to take the temperature. And as I'm taking the temperature, I got down on the ground because I didn't want to put her on the table and stress her out more. So I was going to be on the ground, and her dad was sitting on a chair, just holding her, giving her lots of pats, giving her lots of treats. And as I put the thermometer in, she was like, oh my gosh, jumped up on her dad's lap. And I'm kind of just there holding this thermometer in her bum and holding her tail as my boss walks in. And I was just like, hey, like, yes, this is what I do. So that was quite funny. But that was also a good case for me because it was my first ear case that I personally treated. So I looked at it under the microscope, and she had a Anesthesia infection, which is quite cool to look under the microscope because the little cells look like footprints. And then I was able to treat her, and she came back in 7 days later, and her ears were nice and clean. So that was quite cool, and she was much happier. Dentals are quite satisfying. We grade them from 1 to 4, with 1 being the best and 4 being the worst. If it's graded as a 3 or a 4, they're likely to have extractions needed. This is something that we're really trying to push because your pet's teeth really need to be looked after. Otherwise, they'll have to come in for dentals and have extractions and be under the general anesthesia for longer, and then pain relief and all that sort of thing. So if we can get them cleaned at a grade 1 and then have really good home care afterwards, and that includes brushing teeth or giving there's these things called greenies, which are chewable treats that are proven to remove plaque, or use this powder called plaque off in their food. If we can keep up to date with all that, then we can slow down the progression of this tartar buildup, and then not reach a grade 3 or 4, ideally. But they can be super satisfying if they're nasty like this. You can see all this tartar buildup, all this brown stuff. So with this, you have to, it's like going to a dental with a human dentist. They use that like water blaster scaler, and you just like get it to remove itself. And it's, I don't know, I find it incredibly satisfying, especially when their teeth come out looking nice and clean again. But they can be incredibly frustrating as well, like with actually extracting a tooth. If it's in there fairly well, but definitely needs to come out, that can, like, sometimes they can take an hour just to remove a tooth. I do have a bit of a funny story. I say wear PPE, so personal protective equipment. I will just note that when we do a dental, we wear gloves, we wear a mask and eye cover as well. These photos, we're not wearing gloves because it was prior to doing it. We just wanted to get a quick photo for before and after, so we can show the owners. But when I was a student, I was watching a dental, and I was down the other end of the table. And because I was down the other end of the table, I didn't have PPE on because I didn't think I'd need it. Anyway, I happened to ask a question and have my mouth open. Just at the moment, the vet was doing a grade 4 dental, so way worse than this. It was absolutely just like, yeah, gross. And as I asked the question, he chipped off a piece of tartar and it went flying and landed into my mouth, which made me want to vomit. It was disgusting because that tartar is all just like bacteria and everything. And I was just like, oh my gosh, how is this my life? So when you do a PPE, when you do a dental, please wear your PPE if you ever get down into doing this sort of thing in your life. I know people say being a vet, like people expect it to be puppies and kittens all the time. As I've shown you, it's not always puppies and kittens, but sometimes it is. So yeah, I arrived at work and they're like, hey, so your first consult is with 11 puppies. And I was like, okay, I like that. So these puppies were actually too young. They were coming in for a vaccination, but they were only 3 weeks old, and we usually start vaccinating between 6 and 8 weeks. So I literally just got to cuddle 11 puppies and health check them all, which was fabulous, and I loved my life. It did take a long time. I think it took me like an hour to go through them all, because with each of them, it's super important to make sure that their eyes are good, their ears are fine. With their teeth, you look for any abnormalities in terms of how their mouth is structured and everything. It's also really important to make sure that they all have a suckle reflex. So basically you get to put your finger in their mouth and they suck on you, and it's really cute. Just to make sure that they can actually get enough milk and don't have any abnormalities in that sense. You're also looking for hernias. They often get umbilical hernias, which will need removing in the future. None of these guys had any. You sex them appropriately, so make sure that they know how many males and females they have. I trimmed these little guys' claws as well, because they were getting caught on everything, which the owner was really grateful for, because he was quite nervous to trim them because they're so small. Yeah, and then basically just check their heart. You don't want any murmurs or arrhythmias. Listen to their lungs and everything, and feel their tummies, and then literally just cuddle them, which was very cute. I also had 6 kittens come in the other day as well, which was just adorable. They're a little bit more cheeky than these 3-week-old puppies, but it's really, really cool. And then just as my last slide, sorry, I know this wasn't quite an hour, but that's all right. Sometimes you have an idea in your mind, and the plan actually ends up changing. So this absolutely gorgeous boy, look at those eyes. Honestly, if he gave me those puppy dog eyes asking for food, I would struggle to say no. Even though it's really important to manage the weight of your pets, I would struggle. So as I say, sometimes you think you know what's up, but plans change. So this dude came in for sneezing, and listening to him sneeze, it did sound like he potentially had something stuck in his nose, because we've had quite a few pets come in recently where they actually have like a grass seed or a grass blade stuck at the back of their nose or inside behind their soft palate in their mouth, and they can't remove it. And with this guy being a beagle, he sniffs things a lot. And I was like, oh, that could be it. So he came in on a Friday after all our surgery and everything. So we couldn't book him in for surgery that day. When I say surgery, I mean a sedation, and then you flush their nose and you have a good look under the soft palate and up the nose as far as we can look. So that was my plan. I was thinking, I think this guy has something stuck in there. And sometimes you can treat that by giving pain relief, and it kind of the pain relief reduces the inflammation, which might dislodge the thing, or whatever was stuck in there may have been causing some pain and swelling, which might be causing the sneezing. So I thought, let me give some pain relief for over the weekend, and then come in Monday, Tuesday, and we can do the sedation and flush if nothing has improved. So that's what we did. And I mean, the reason I went with that is because his temperature was fine. All his vital signs were fine. He was a healthy dog, except for the sneezing. So if there was something more crazy in his vitals, I would have potentially thought of other things. But that's where I went with this case. Anyway, so he comes in. I can't remember whether it was Monday or Tuesday, but he came in, and we sedated him and looked up his nose. Obviously we can't see as far as I don't know, as you'd like. In order to see even further, you'd need to do a CT scan or an MRI. But we couldn't find anything there. We couldn't find anything under a soft palate. But what we did find was that his tonsils were swollen. So he had tonsillitis. Now, I couldn't do that. I couldn't look at that in consult, because opening his mouth, he got really stressed with it. So it was kind of one of those things where we had to wait until he was sedated in order to have a better look. But yeah, so he didn't end up having anything stuck in his nose or under a soft palate. We did flush it and all that, but he had tonsillitis, so then we had to treat that. And he's getting better as well. He's such a gorgeous little boy. So yeah, sometimes your plans do change. You try one thing, it might not work, or it sort of works, but not as well as you want it to work. We can have discussions all the time, like with your colleagues and everything. And that's one thing that I found very important with my whole becoming a vet, is the mentorship. So getting that from my boss, just having somebody there to support me, to talk over cases, just to make sure that I'm actually on the right track. Yeah, it's so important. So that's a bit about me and being a vet and what being a vet is like. Does anybody have any questions? I might just stop the screen sharing. Oh, I see this. Okay, so is there anything you regret throughout your career? Is there anything you wished you could have done differently? No, so far I don't think so. I mean, I'm still a new grad. I haven't been a vet for a long time. But no, I think throughout my studying, maybe I didn't, maybe there were some things that I could have focused a bit more on, but I also got a lot of experience because I was part of a lot of different clubs and that sort of thing. So I got a lot of practical experience. So no, I don't think I regret anything at this stage. Yeah. Have I ever done surgery by myself? Yes, I have. Which was quite like exhilarating, scary, but exciting, because I know that I'm capable. I recently did, it was a minor surgery. I did a dog castration, but it was exciting for me because previously at uni we've like shared the castration, so we each do one testicle and then share the closing up of it and everything. But I worked through this case in terms of, I took the bloods, looked at the bloods, because before general anesthesia we take bloods, and then to look at what their liver and kidneys are doing, because that tells us how they're going to be able to go through the general anesthesia in terms of metabolizing the drugs. And sometimes we can change what we use in order to make sure the GA is as good as possible. So I took the bloods, I placed the catheter. I think my nurse my nurse trimmed and then scrubbed the dog for me while I scrubbed in. And then I did the whole surgery by myself, did the recovery, dog's doing well. So yeah, I have done it. Again, my mentor was there for me. If I ever needed her, she'd come in and, she'd check occasionally and that sort of thing, just to make sure I knew that I wasn't by myself. Yeah, and then I did that stitch up, and I've done dentals by myself and ear cleans by myself and that sort of thing. Nothing too hectic just yet, but getting there, trusting the process. Yeah. Does anybody else have any questions?
Yeah, I actually had someone private message me, and they asked, what is your favorite surgery/animal?
Okay, so my favorite animal is an alpaca. There's like no doubt about that. Ideally, I would become like the alpaca vet. I don't think I'll ever, at this stage, I don't want to go through the whole internship, residency, specialization, but you can have a special interest, which is what I would class myself as. So they are 100%, because they're got the cheekiest personalities, and they also have a slightly different anatomy to other animals. So they're classed as a pseudo-ruminant, which is between a cow and like a monogastric, so sort of like a dog. So like a cow has 4 stomachs sort of, and then the alpacas have 3 stomachs, so things change and everything, and obviously they're super long necks and they're just weird and I love them. Favorite surgery? I've actually quite enjoyed watching enucleations, which is the removal of eyes. I think it's such like a weird surgery, but I think it's very interesting. For myself, I think when I first started thinking about being a vet, I thought spays and castrations were the main thing. So I've got my own goal to get really good at doing those, do them fairly quickly, have a small incision and that sort of thing. So that's my goal in terms of surgery at this stage in my career. Somebody says, what advice would you give for someone who is getting a dog for the first time in terms of keeping them healthy? So with that, I would definitely say take them to the vet, make sure that they get all their puppy vaccinations. That's a bit different. The puppy vaccinations that they need are a bit different depending on where you live in the world, but your vet will be able to help you with that. Keep them up to date with their flea and worm treatment. It's important that you're using flea and worm treatment from the actual vet, because I know supermarkets sell them, but often their concentrations of the drugs aren't at a high enough level for it to be effective, or some of the drugs actually have resistance. So some of the like fleas and stuff, it doesn't work on them. So definitely get them from your vet practice and get advice with that. I would say start them early with brushing their teeth, because they will need a dental at some stage, but as the more you can slow down the process of them requiring it, the better. You can just use a baby toothbrush, and then there's toothpaste that is sold, but you can just use something like Tasty. So if you open a can of tuna, there's all that like tuna juice sort of thing. You can literally just put the toothbrush in that and start brushing you just need to do the outside, the bits of their teeth, not the inside, like not that level, just that level. Yeah, I think those are probably the best things that I can offer for advice at this stage. Yeah. Yes, you can ask a question. Go for it.
Thank you. First off, that was a really interesting presentation. Thank you.
You're welcome.
And I have 2 questions actually. First, what would you say is like the best part of your job, and what would you say is like the worst part?
Mm-hmm.
And then second one is, do you think being a vet allows for you to travel a lot? Since I can imagine like different countries, different places have different native animals and stuff. So what would you say about that?
Yeah. Okay, so the first question, best part of my job, I think for me, I love client interaction. A lot of people, I think, go into vet because they don't want to work with people, but you actually work with people so much because they're the ones you're relying on to tell you about their animal, because your animal obviously can't just tell you where it's sore and that kind of thing. So for me, seeing an animal get better because you've treated it is just amazing for the animal itself, and then amazing for the clients. And as I said, that's my why. I really want to just help. And I think watching an animal get better and watching clients just feel so much more relaxed and trusting, that's my favorite part for me. And then the worst part, I don't think you can get past the euthanasias. But for me, the only euthanasias I've had to do at this stage are animals that are really sick, and it's actually a great treatment option for them, in terms of the fact that I'm a firm believer that it is better to say goodbye a day early than a day late, because then they're not going through that extra pain. And what I find really difficult with that is, again, the clients. I say recently, I had to put down my dog 2 years ago, which still feels super recent. And I was in Rome while we had to put him down, so it was on video call, and it was like the worst experience ever. So I can really, really relate to the emotions that are going through the client's head while they're having to say goodbye. And I think, just that just pulls at my heartstrings, and it's hard, but I know that it's the right thing, and I'm grateful that I have the ability to take away the pain, I think. Yeah, so that was a bit Debbie Downer, but yeah, that's kind of where what I'd say my worst part is. In terms of the travel, obviously we're pretending that COVID doesn't exist or that it's going to get better really soon, which would be so ideal. But yes, you can travel basically everywhere with this job, depending on where you get your degree. So there is, you need to make sure that your university is accredited in different countries. So I'm really lucky, mine is accredited basically all around the world. If I want to work in America, I have to sit the NAVLE, which American students have to sit as well. I haven't done that personally because at this stage, especially with COVID, I don't have plans of working in America. But yes, you can travel everywhere basically, and there's lots of volunteer programs that love you to go and do all the de-sexing or the vaccinating, like with rabies, that's a big thing. And then what we learn, which I think is really important to note, is first principles. So you might see an animal that you've never seen in your life before, like say Friday, right? I saw a bird called a wecker, and the only reason I knew it was a wecker was because the person that brought it in told me it was a wecker. And it's a native bird in New Zealand, flightless, and I had to examine it because he said this thing it didn't look like it could drink water, and it just didn't seem to be standing up properly. And when I looked at the bird, it was very neurological. So what I mean by that is it was like head shaking, and then it could stand up, but it would literally just like flop its head back. And I was like, what the heck do I do with this? But what I had to do was just go back to my first principles and be like, well, what would I do if this was a dog, or what would I do if this was a cat? And so I ended up treating it. Obviously, I did some research as well, asked a few people. And the bird seemed to improve and has gone home with a wildlife carer now. So you can come across any random animal and just go back to your first principles and be like, oh yeah, this is what I probably should do, sort of thing. Yeah. Anybody else? No worries.
All right, if there are no other questions, I think we're going to wrap up now. Thank you guys all so much for coming. Thank you, Dr. Lianne. I really enjoyed this presentation. We haven't had a vet yet, so it was like super interesting. And I love seeing all the animals. Thank you so much.
You're welcome.
Right now, I'm going to put a link to the Google form for these certificates in the chat. Give me like a quick second. There we go. And as I mentioned earlier, you'll just fill out your email, your name, and how you heard of our organization, and then we'll be sure to send out the certificates in the next week. And yeah, so thank you guys all for coming. And yeah, thank you, Dr. Lianne. Again, I really enjoyed hearing from you.
Thank you for asking me to come on. I'm glad that I was able to share that with you guys. And please feel free, if you have any questions about vet or anything, just chuck me a message on Instagram. I love answering questions and helping people out with the whole thing. And if I don't know the answer, I probably know a few people that I could